Phlebotomy test questions. Question 1. The most common cause of contamination in blood cultures is improper transport, faulty tube, inadequate site cleansing, not fasting. Inadequate skin cleansing allows normal skin flora to enter the culture, causing false positive results. Proper antisepsis with chlorhexidine or iodine, allowing to air dry completely, and not repalpating after cleaning are critical steps to prevent contamination. Question 2. Why should the first drop of blood be wiped away during capillary collection? It is too small. It may be contaminated with interstitial fluid. It contains too many white blood cells. It causes clotting. The first drop contains interstitial fluid released during skin puncture, which can dilute the specimen and alter test results. Wiping it away ensures subsequent drops consist of pure capillary blood for accurate testing. Question 3. What is the maximum number of attempts a phlebotomist should make on one patient? 1, 2, 3, unlimited. Phlebotomists should make no more than 2 venipuncture attempts on a single patient. After 2 unsuccessful attempts, another phlebotomist should be called to attempt the draw to reduce patient discomfort and complication risk. Question 4. What action is required when collecting a blood alcohol level? Use isopropyl alcohol to cleanse the site. Use soap and water or a non-alcohol-based cleanser. Blow on the site to dry it. Apply iodine and wait 5 minutes. Alcohol-based cleansers can interfere with blood alcohol test results, causing falsely elevated levels. Use a non-alcohol antiseptic such as chlorhexidine, povidone iodine, or soap and water followed by sterile water rinse. Question 5. When performing a finger stick on an adult, which site is most appropriate? Index finger, tip of thumb, ring finger, center of palm. The ring, fourth, finger and middle finger of the non-dominant hand are preferred for capillary puncture because they have less callus tissue and are less sensitive. The puncture should be made slightly off-center on the fleshy pad to avoid bone contact. Question 6. What is the function of the additive in a lavender top tube? Clot activator, anticoagulant EDTA, gel separator, coagulation enhancer. Lavender top tubes contain EDTA, an anticoagulant that binds calcium to prevent clotting and preserve cell morphology. These tubes are essential for hematology tests such as complete blood count (CBC). Question 7. What should be done if a patient refuses to have their blood drawn? Proceed anyway if the test is critical. Notify the nurse and document the refusal. Call the laboratory supervisor. Ask a coworker to try instead. Patient autonomy must be respected. Forced blood collection is unethical and illegal. Notify the nurse or physician so they can discuss the test's importance with the patient and document the refusal in the medical record. Question 8. Which of the following errors could affect bilirubin levels in a blood sample? Hemolysis, exposure to light, use of heparin tube, low tourniquet pressure. Bilirubin is photosensitive and degrades rapidly when exposed to light. Specimens must be protected by using amber-colored tubes or wrapping in aluminum foil immediately after collection to prevent falsely low results. Question 9. What is the proper angle for needle insertion in the antecubital vein? 15 to 30 degrees, 45 to 60 degrees, 5 to 10 degrees, 60 to 90 degrees. The recommended needle insertion angle for antecubital venipuncture is 15 to 30 degrees. This shallow angle allows smooth entry into the vein while minimizing the risk of penetrating the posterior wall. Question 10. What should be done immediately after removing the needle from the vein? Apply the bandage. Tell the patient to get up. Apply pressure with gauze. Shake the tube. Immediately after needle withdrawal, place sterile gauze over the puncture site and apply firm pressure for 3 to 5 minutes to promote hemostasis and prevent hematoma formation. Instruct the patient not to bend their arm, as this can dislodge the clot. Question 11. What should a phlebotomist do if a blood sample is rejected due to clotting? Relabel the same tube. Submit the tube anyway. Redraw the specimen using correct technique. Add more anticoagulant. Clotted samples cannot be used for tests requiring whole blood or plasma. The specimen must be discarded, and a new sample collected using proper technique, including gentle inversion to mix anticoagulant immediately after the draw. Question 12. Which test is most affected by patient posture? Hemoglobin A1C. Electrolytes. CBC, complete blood count. Iron levels. CBC results are significantly affected by patient posture due to hemodilution and hemoconcentration. Standing or sitting upright increases blood cell counts compared to lying down, so consistent patient positioning is essential for accurate serial monitoring. Question 13. Which of the following is a reason to reject a specimen? Tube with properly matched label. Tube drawn within proper order. Hemolyzed specimen. Tube drawn by a nurse. Hemolyzed specimens yield inaccurate results for potassium, LDH, and other intracellular analytes and are routinely rejected by laboratories. Hemolysis is typically caused by improper collection technique and requires recollection for accurate results. Question 14. What should be done with a needle after use? Recap and dispose in regular trash. Throw into sharps container without recapping. Break it and throw in biohazard bin. Place it in a red bag. Used needles must be disposed of immediately in an approved sharps container without recapping. Recapping is a major cause of needle stick injuries and is prohibited by OSHA unless a mechanical device or one-handed scoop technique is used. Question 15. What type of tube is typically used for blood typing? Red top. Lavender top. Yellow SPS. Pink top. Pink top tubes contain EDTA and are specifically manufactured for blood bank testing, including blood typing, ABO/RH, and cross-matching. These tubes meet special requirements for donor and recipient compatibility testing. Question 16. If a patient faints during a blood draw, the phlebotomist should first continue the draw, elevate patient's feet and remove the needle, splash water on the patient's face, call a doctor immediately. Immediately remove the needle to prevent injury, then position the patient supine with legs elevated to promote blood flow to the brain. Do not leave the patient unattended, and do not continue the draw. Question 17. What is the term for destruction of red blood cells? Hematopoiesis. Hemoconcentration. Hemostasis. Hemolysis. Hemolysis is the rupture of red blood cells, often caused by mechanical trauma during collection or improper handling. Hemolyzed specimens are rejected by laboratories because they produce inaccurate test results, particularly for potassium and LDH. Question 18. Which action would violate OSHA standards? Wearing gloves during blood collection. Eating or drinking in the lab area. Disposing of a full sharps container. Using hand sanitizer after removing gloves. OSHA prohibits eating or drinking in areas where blood or other potentially infectious materials are present due to risk of inadvertent exposure. Designated clean areas must be separate from specimen processing areas. Question 19. Which vein lies close to the brachial artery and must be used cautiously? Basilic, cephalic, median cubital, radial. The basilic vein lies near the brachial artery and median nerve, making it a higher risk venipuncture site. The median cubital vein is preferred. The basilic should be used only when other veins are inaccessible. Question 20. What is the best method to prevent misidentification of a patient? Check the patient's room number. Ask the patient to confirm their diagnosis. Ask the patient to state their full name and date of birth. Compare handwriting on the requisition. The most reliable patient identification method uses two unique identifiers, such as full name and date of birth, stated by the patient, when possible, and compared to the requisition and wristband. Active patient participation enhances safety.